Hi, my name's Corey Prakniak-Rincon, and I use they, them, theirs pronouns. Since 2020, I've been the Senior Advisor on Public Health at the International Association of Providers of AIDS Care, or IAPAC. If you're joining this summit, chances are pretty good that you already know how big of a role stigma and discrimination play in the global HIV pandemic. And this is even more true for key populations and other groups like women and girls and people of color who face multiple forms of marginalization. The Global AIDS Strategy for 2021 to 2026 includes specific targets that we're trying as a global population to reach by 2025. And those include that less than 10% of people living with HIV and key populations experience stigma and discrimination. It also includes that less than 10% of these individuals are facing punitive laws and policies in their countries or in their localities. These targets are very important given the role that stigma and discrimination play in preventing people from understanding and seeking testing and prevention services for HIV. They also create a big barrier to getting care for people who are living with HIV. And stigma and discrimination at the systemic level prevent appropriate services and policies from even being implemented. So one clear example is instead of using public health best practices to address things like sex work or drug use based on what we know is best for people and their health, our policies are often driven by stigma, fear, and political expediency of whatever seems most popular and easy to explain to voters. When we think about solutions to these issues, often we immediately go to national laws, policies, and initiatives. And in many cases, this may actually be the fastest and most comprehensive way to make progress if it's possible. But for a lot of reasons, it's often not. In countries like the US, many relevant issues like regulations around sex work are usually left to the states to decide rather than the federal government. And even when the national government can act, it often fails to do so. I think this is especially true in times of political polarization and when we have a divided government that's not in agreement on what should be done. And finally, we know that no national law or policy is going to reflect all of the needs of local individual communities. And signing a bill into law is just the first step towards change in any case, whether that's at the national or state level. For example, a national bill that makes discrimination against LGBTQ people illegal would be a really big victory. But to actually make that meaningful, there's a lot more that needs to happen to ensure that LGBT folks are included at all levels of society, and not just an absence of discrimination, or when there is discrimination, you can go to court for it. We know that that's not going to really advance inclusion to the full level that we're aiming for as advocates for these populations. So for all of these reasons, when we think about ending stigma against people living with HIV and key populations, it's really important that we include a local perspective and think about how we can leverage actors at the local and state level to affect change in ways that aren't necessarily the biggest and shiniest examples, like passing a big law or initiating a big program, but that can really make a difference. In this talk, I'm largely going to refer to the LGBTQ population because that's where the majority of my experience lies, especially in the examples that I'm going to share. But I want to emphasize that I think a lot of the same principles can be used with respect to other relevant populations in controlling HIV epidemics. Last year, IAPAC conducted a study of LGBTQ health equity that included 50 fast-track cities from around the world. For those of you who aren't familiar, the Fast Track Cities initiative basically lets cities commit to ending HIV in their city or municipality and sets a bunch of metrics for how they're going to get this done. The study included a desk review of laws, policies, and supports that are available to people in these 50 cities that we included, but we also included a survey of 275 key informants to see what they thought about what was happening on the ground. We asked a lot of questions that related to stigma and discrimination facing LGBTQ people generally, but also sex workers, people living with HIV, and racial and ethnic minorities, among other groups, since we know that these are really important in addressing LGBTQ health and in our broader mission as an organization and as a Fast Track Cities network in ending HIV. Every question that we asked key informants about, like whether something was a problem or not in their city, a majority replied that it was a problem, which reaffirmed our belief that what we were asking about was important. But to give a couple specific examples from the research, gender identity discrimination was rated highest in terms of these different social issues relating to stigma and discrimination. That was followed by treatment of sex workers, criminal justice issues facing LGBTQ people of color, discrimination related to sexual orientation, and discrimination related directly to HIV status. But the numbers here were fairly close, and this to me suggests that there's no silver bullet where one issue particularly stands out and could really be used as the central way for us to address stigma and discrimination. All of these things were considered problems to various but pretty close levels, which really shows that we need a holistic approach to addressing this. Now, since we published our initial report last year, we've conducted a lot of additional analysis and study that's looked at things like how these issues are associated with different aspects of ending HIV epidemics. So, for example, we looked at progress towards the 95 targets, or how the discrimination level in a city related to how key informants thought that the quality of care was. And we found a lot of associations here, which to me helped to reinform the importance of addressing stigma and discrimination to end HIV in our cities and around the world. And I think it's also important to note, which is probably obvious to everyone, but just so it doesn't go unsaid, that we also have the benefit of advancing human rights and reducing inequities, not just related to HIV, but with respect to a lot of other things that many of us care about. Now, in our report, we also explored sources of resiliency, which we thought was important because all of the issues facing the community are important, but also there's a lot of strengths that we wanted to look at. And we found that in terms of engaging and supporting the local community, nonprofits were rated best. They received a 3.9 on a 1 to 5 scale, where 1 was poor and 5 was excellent. Health and social services providers, local governments, and the private sector all ranked a little bit lower at around a 3.0 on the same scale. In another part of the survey, we asked about different types of health services and how good they were at serving LGBTQ individuals, and we found that HIV services were the best rated. So kind of putting all of these facts together, some of my takeaways are that stigma and discrimination are problems in local communities around the world when we think about LGBTQ health, HIV, and related issues. We also have to think about these issues holistically, given the diversity of populations affected by HIV and how all of these things are intertwined. Nonprofits and HIV providers are kind of ahead of the pack in terms of serving this population, which puts them in a good position to support even larger change and help them to be leaders. And local governments have a good deal of room to grow in terms of their support, even though there were lots of positive things that were mentioned about city and local governments. As I mentioned, they didn't get the best ranking in terms of how well they were doing so far. So I think that that's, to look at the positive side, an area of growth. And that's kind of what I want to talk about in the rest of my talk today. I'm going to look at some work that I've done here in the Commonwealth of Massachusetts to advance LGBT equity. And I hope that this will have broader implications for how we can serve people who are living with and affected by HIV and other key populations. So for 3 years before I joined IAPAC, I led an independent state agency here in Massachusetts that's dedicated to LGBTQ issues. During my time as director of this agency and during its very long history that came before me, our agency made a lot of progress on advancing LGBTQ equity. And this progress took place without respect to things that were going on at the national level. We had some positive things that happened during those couple decades that the agency has been in existence. We had some negative things happen, backlash happening at the national level, but the progress continued at the state level regardless of what was going on elsewhere. In addition, while there were some important state laws that were passed to help advance this agenda, as well as the first ballot initiative in the country that solidified a ban on transgender discrimination, most of the work that our agency did was done without respect to changes to the law. I also want to note that during my time at the agency, we generally didn't receive much support or objection from our state's governor. So the real agents of change, in addition to the advocates and activists who were part of this movement, were other players within local and state government who took on a leadership role, whether those were the heads of schools or school districts, the heads of state agencies, or others who are interested in advancing this agenda, even without being told that they have to by a state law. While our work varied depending on which entity we were working with, we generally employed a 4-point strategy that had developed largely organically over the years leading up to my time with the agency. First, we advocated for cultural competency trainings for local and state public employees. One of our most successful efforts at doing this was in schools over the course of a couple decades, helping to add LGBTQ issues into anti-bullying initiatives. This was voluntary for schools to do, so we tended to hear from a lot of the same schools year after year, and we really had to push for schools that needed the training the most who were reluctant to do it. But we had support from the state's Department of Education, and we had a lot of outreach efforts to try to increase this, and that definitely happened over the years. However, we really wanted to look at how we could train other state employees and local employees as well, where we were able to, on how they could work towards ending LGBTQ inequities, including the discrimination and stigma that they faced. And a lot of these tied in closely with our state's work to end the HIV epidemic. One of the biggest success stories that we happened, which took place a couple years before my time, was to implement a training of every employee with the Department of Youth Services, which is our state's juvenile justice agency. As you can imagine, the challenges that LGBTQ youth face when they're in custody in the juvenile justice system, which is something that's hard on all youth and really impacts youth that are low income or youth of color. But for LGBTQ youth, all of the challenges are really increased. These are gender segregated facilities. You're living with roommates. So there's a lot of challenges there for LGBTQ youth, and they don't have access to the same community-based and school-based services that other youth have. So that can make life really difficult and isolating. If the staff at these facilities don't understand and respect LGBTQ identities, not only are they not going to be able to intervene to address bullying and victimization that's happening, but they're also likely to perpetuate this victimization themselves, whether or not they're intended to do that. Luckily, our agent found a tremendous advocate with the Commissioner of Youth Services. He implemented a training initiative with our agency's support that was tailored to the unique needs of his department. Based on conversations with staff, they found that the message of youth safety really resonated, even for people who weren't knowledgeable about LGBTQ youth and may have not been politically or personally in support of a lot of the policies that people like me would like to see advocated. They learned that this wasn't about their political opinion or their religious views. We weren't trying to change anyone's mind about what they thought about sexual orientation or gender identity. What we were trying to do is make sure that all youth who were in their custody had a safe place to live and a supportive environment where they can thrive. And that message really resonated. The commissioner led by example and decided that the training program would start with himself and be required for all staff, whether that was people on the ground who actually interact with youth on a daily basis, or the people who are making the administrative decisions who are just as important in a different way. We really need both sides of this equation to see change happen across the agency on a structural level. The training included not just what LGBTQ stands for as an acronym, which is difficult enough because we have lots of letters and lots of identities that are part of our community, but it also included looking at specific policies that were relevant to the agency, which I'll discuss a little bit more ahead. This particular department was one of just many where there was progress by the time I started work at the agency. What I really wanted to do was to try to make training as widely available as possible to cover as many state employees as possible. It proved to be really difficult to get support from the governor and the legislature to make this required. So instead, what we did was to start with the Office of Health and Human Services, which oversees a lot of entities like the Department of Youth Services that I mentioned, the Department of Public Health, and many other that are very important and that comprise a really big chunk of the state's workforce. And the idea actually came to us from the Executive Office on Health and Human Services, who said a lot of agencies are implementing this. It's being done, in kind of different ways. It would be great to have some consensus so that all of our staff were getting the same training. And we were definitely on board with that. One of the first meetings that I took as director was to start this process, and I think it was my second to last day as director when I recorded the first version of the training materials. So this was not a quick process. It took over 3 years, but I definitely think that it was worth it. While I wasn't able to get the training to be mandatory, I did get the heads of 8 government agencies to sign off on the curriculum and to commit to using it as a guide moving forward, which was a really big task that was accomplished with tons of people advocating for this throughout their agencies. We also had them commit to the goal of trying to train as many employees as possible. And we got support from the Executive Office to start offering this training across the Health and Human Services agencies, rather than having to do it individual for each of the 8 or 9 agencies that comprise the Executive Office. And this was a lot more efficient for us and had a bigger reach. In the meantime, we also used the same framework that we had developed with them to start advancing trainings for other public employees. So it really had an important impact for us in terms of making that happen. The second part of our strategy was to advance policies across state and local governments that targeted discrimination and advanced inclusion. Before my time at the agency, we had made good progress on getting agencies to implement non-discrimination policies. Then the state passed a law that banned gender identity discrimination. As I mentioned, it was also reaffirmed at the ballot box. So a lot of the response that I got when I was starting this work was, why do we need anti-discrimination policies? It's already banned at the state level. But for better or for worse, just passing a law is not going to end discrimination. And we know this, or else it would be really easy to advance the work that we're here talking about today. So instead, we try to emphasize that we're not just trying to end discrimination as a legal issue, we're trying to advance inclusion. I talked about the Department of Youth Services. They had a non-discrimination policy, but they also had specific policies about what that meant for trans and non-binary youth. If they're in the custody of the state and there are gender segregated facilities, how are these youth going to be placed? So they made a policy to explain exactly how this would be done so that the identity of the youth and what they felt was safest for them was going to be recognized. Similarly, at our Department of Motor Vehicles, rather than people just being able to choose an MRF on their license, they were also able to pick an X and not identify any gender at all. And the agency implemented policies for how this was going to work. I was one of the, not the first person, but one of the first people to kind of go in and test this out for myself. And I was able to go in and get an X marker on my license without a blink of an eye from anyone in the agency, because they had gotten some guidance on how to treat trans and non-binary clients, and they were ready to do this. These are just a couple examples of a lot of policies that can be advanced to really increase inclusion and not just end discrimination as a legal matter. The next part of our strategy was to increase inclusive data collection so that sexual orientation and gender identity were being measured in all interactions that the state has with its clients and in all of the research and the incredible amount of data that they conduct. A lot of times people wanted to know, why should we prioritize LGBTQ issues? We don't think we have a lot of clients, or it doesn't matter if they're LGBTQ or not. We treat everyone the same. But how can they know the experience of their LGBTQ clients if they don't measure these factors? How do they know that they're not being lost to follow-up or having a bad experience at the agency or not being able to access services? In addition, when we think about public health data, how can we know how issues like COVID-19 are really impacting LGBTQ people if we're not asking the questions? So this was a really important thing for us to try to advance. It's also a tough thing for a variety of reasons. We often got doubts about how the questions should be asked. It's often really expensive to change data systems. So it took a lot of advocacy to really advance this. And you have to be patient with agencies that have budget considerations. But I think it's really critical so that we can understand the needs of the community, the way that discrimination and stigma impact all sorts of services that we need to access, and more. And the last part of our strategy is really simple. It was just applying all of the three things that I already mentioned to anyone else who gets money from the state, whether those are vendors, contractors, grantees, or otherwise. So for example, we have a lot of group homes across the state that are managed by nonprofits. Those nonprofits should be held to the same standards and given the same supports as people who are doing this as state employees. In conclusion, this presentation is really just sharing a few ideas for how policies can be advanced at the local and state level to address stigma and discrimination. As I mentioned, I have been focused largely in my work on LGBTQ folks, but I think that this could apply to other key populations and to people living with and affected by HIV more broadly. This can happen even when we have political barriers at the national level or at the state level. We can really harness the leadership where we find it and the people who we do identify as advocates to make a lot of progress on these issues. And in my opinion, they're often more impactful than passing a law that people don't understand or follow or really use to advance inclusion. And I especially want to give a shout out to our fast track cities, because I think that this is a really big part of what they sign up to do at the local level, which is leveraging political leadership to make these changes happen so that we can end HIV epidemics. I want to quickly thank Jose Zuniga, who was our main partner in conducting the research. We worked on that together. I also want to refer back again to the report that I mentioned, which you can find at iapac.org if you want to learn more about what we found with LGBT populations and what we recommended as next steps for all different actors from the local to international levels. And I hope that this presentation can just give a couple ideas for how we can work to end stigma and discrimination across the populations that we serve. Thanks.